Hello, Paul.
Hi.
We are here to talk about VIDIMO,
Mm-hmm.
an online application.
Mm-hmm.
Could you tell me how VIDIMO would assist social care and what the benefits would be if social care is to take VIDIMO?
Okay. Well, some of the biggest problems social care have centre around visibility of available bed assets in care homes, rehab centres, residential centres, etc. And the time that it takes staff to locate available beds in any of those locations. So using VIDIMO, we can demonstrate a significant efficiency drive. Normally when social workers or brokerage teams look for available beds, it can take, let's say, anything from 10 to 15 minutes. Using VIDIMO, we can reduce that time down to a handful of seconds. So it works out somewhere in the region of a 6,000% efficiency for social care. And then, of course, there's other concerns about being able to manage patient or client bookings from a single location rather than using Excel spreadsheets and the like. And then thirdly, there's the efforts around delayed transfers of care, which again is a significant amount of time and effort for reporting, managing and monitoring of those delays.
If we go back to management of available assets like care home beds, nursing homes, and we know that a lot of care homes are being closed down. There is a shortage of nursing EMI beds. How would VIDIMO provide the local authority with the ability to actually see the beds which are available?
Well, one of the things we want to do, and we're happy to promote, is we will give VIDIMO access to VIDIMO for free to non-profit, charity or small care home organisations. The bigger ones obviously will pay a certain amount of money, but giving VIDIMO essentially free to these smaller organisations allows them to offer their visibility or their availability of beds to any social care borough that participates in using VIDIMO.
And would VIDIMO be able to capture all the block book beds that some of the boroughs obviously have, and how would that be managed?
Well, that's really important. There are many boroughs that operate a contract-driven or block-booked arrangement with various care homes, and some that don't. And what we've encompassed within VIDIMO is the ability to manage not only your block-booked and contract assets, but also have that extended visibility of participating and even non-participating care homes. So all we're trying to do is give the broadest possible visibility of available beds to any local authority, adult social care organisation that would like that access.
What about the extra sheltered and sheltered homes, which obviously these days we're using much more in order to place people there, bring them more independence? Would VIDIMO provide the ability to actually view and manage extra sheltered and sheltered as well?
Absolutely. If you think of it as if there is a bed involved, VIDIMO will pretty much be able to manage every facet of that.
That means that additional access would need to be given to housing who manage sheltered, and obviously brokerage or adult social care who manage extra sheltered homes.
Indeed. So because VIDIMO is a web-based application, there's no additional sort of IT footprint on the social care estate. So if they wanted to extend it to housing, we'd be happy to discuss that with local authorities. Our primary focus at the moment is brokerage teams, social workers, and their day-to-day client sort of experience.
That all sounds very good. However, everybody these days thinks about the cost. So would VIDIMO be able to save local authority financial cost?
Well, given the previous example of a 6,000% efficiency gain, how local authorities manage that benefit, I guess, is entirely up to them. Whether it means that they can refocus staff efforts onto higher priority things, such as detox, such as actually focusing on patients and the services provided to patients. Again, that's only a question that they can answer.
Of course. You just mentioned detox, which is a very big priority across UK anyway, especially now that we're coming up to winter time. So how would VIDIMO assist social care in better management of detox and reduce the time that is spent in discussion of detox?
Well, essentially there are three facets to delays. There's the actual monitoring of delays, realising the moment they happen rather than discovering it in a weekly meeting or via emails. Then there's the actual management of those delays, and we're providing a single platform for both health and care to manage delays in real time. And that means in a virtual sense, rather than having to travel from A to B and then conduct, let's say, a once a week meeting. This can be broken down into a series of, let's say, mini visits to this virtual platform, where delays can be addressed at a time that is convenient for social care and a time that is convenient to health also. We are at the moment facing a problem where the senior management is continuously during winter pressure times asking for a number of delays and how the detox is being addressed, which means numerous emails are being sent to different senior management. Would VIDIMO be able to assist with that? Well, that's really one of the key facets of VIDIMO. And again, because it operates in real time, various managers throughout the management chain would get that real-time statistical view of current delays, which ones have been actually verified as delays, which ones are potential delays, how much it could cost the borough, how much it's currently costing the borough, and literally every key sort of indicator about delays is available to every level of management at any time during the day in real time. It's not a snapshot, it's real time as it happens. As you click, that is the current status the moment you click.
Which would obviously save a lot of time by the senior management emailing junior management and asking where we are with the delays and forwarding everything to ADAS and Department of Health and double signing off.
Yes, indeed. Yeah, it will effectively act as a barometer for senior management without the need of having to push down requests down the chain to sort of junior managers and brokerage, etc.
Well, thank you. That is very helpful. With regards to VIDIMO's other aspects and what it can do, during the winter pressure times, what usually happens is that what we call hospital is usually on opal status, and there are different levels as we understand. But when there is a tremendous shortage of beds, obviously both health and social care are aware of it, and the senior management is advised. Is there some sort of a trigger in VIDIMO that would alert social care and their management about any internal incident, external incident, or extreme shortage of bed, which then would make social care start the initiative of moving people into different settings in order to release the beds? And how would that be done?
Well, that's one of the key aspects of VIDIMO. We've created a virtual platform that brings both health and care together in a virtual sense and does it in real time. So if a hospital is experiencing challenges through beds, VIDIMO lets every care professional within the hospital have visibility of that as it's developing rather than at the time it becomes a crisis. And that also means social care hospital teams would have similar levels of access. And therefore they can watch the pressures building and start planning ahead rather than simply reacting when the inevitable email comes along saying, we've got a problem. So it's a much more, we're moving and transitioning from a sort of reactive environment to something more proactive.
Yeah, and more manageable, obviously.
Indeed, yes.
So the VIDIMO would have the capability of escalating or sending an email of escalation to people who have been picked on their list to be informed of any major crisis that is actually happening at a time.
Yeah, that's right. And we've broken it down to individual levels. So a hospital has the choice of having totally different and independent groups to be notified at OPAL 1, 2, 3 or 4, or some people may be notified as it goes up each level. Similarly, they don't have to be users of VIDIMO to receive those alerts. So that could go to, let's say, a local authority leaders. It could go to trust management. It could go to STPs. Again, VIDIMO acts as a barometer for multiple layers of management.
Okay, while we are still talking about the social care, and we sort of touched on escalation, I have noticed that VIDIMO provides information on major incidents, and unfortunately we did have quite a few major incidents in the last few years. Could you tell me how would social care be notified by them that there is a major incident happening? Because at the moment there are a lot of telephone calls going on, which we experienced in the past, and people are moved from one nursing home to another. We lose them, we lose sight of them rather than the patient. And if we had one sort of a specific platform where people would be notified immediately that only the correct people, rather than using emails and rather than using telephone, that would actually release those phone lines for the most important calls.
Absolutely, I think
elaborate?
I think that's such a key point. And from a social care perspective, I think the recent fire at a care home sort of really does, no pun intended, bring it home. So in an event of, let's say, flooding at Richmond or a fire at a care home, there are going to be a percentage of people that may require hospitalisation because of injury, and there may be a large number of people that require moving to alternative, albeit temporary, accommodation until such time that a more permanent sort of setting can be found. And VIDIMO provides that platform to be able to manage everyone in that care home from a single view. So multiple boroughs could look and work together in a virtual sense to address the problem, or a single borough could address it in isolation, but they would still have the same platform to use.
So when it comes to coordination, would there be specific borough, specific hospital, or specific lead via the VIDIMO indicated right on the portal? Or?
Yeah, in a hospital sense, yes, there is. We've put a significant amount of effort into allowing hospitals to manage, or dare I say trusts, to manage multiple hospitals across the estate. In fact, multiple hospitals across a city. So it's not isolated to one individual trust. So in the case of let's say a real major incident such as 7/7, 9/11, Hillsborough, etc., a management team could use VIDIMO as a single point of contact for every hospital in a city, or chosen hospitals in a city, and that's very easily picked from a list. And any participating hospital is notified in real time that they are now on standby for a major incident, so that they get that valuable sort of perhaps 15 or 20 minutes heads up to actually start moving people out. And again, social care get visibility of that, especially the hospital teams. So none of this comes as a shock. It's that little bit of leeway that everybody needs rather than hitting the panic button every time.
So would we be able to see where people are actually being taken?
Yes, absolutely. And again, in real time.
Okay. And if we could now, from major incidents, jump across to hospitals.
Yes.
Despite of all the collaboration that we are trying to do with social care as well as health, there are certain differences as to how VIDIMO would assist health. Could we talk about a few of the differences from visibility of beds within the hospital? How would that be achieved, and what the benefits would be if we start with, let's say, the mouth, which is the A&E, of course. How would VIDIMO assist A&E to manage the number and the influx of people going in?
Well, we're talking about patient flow, effectively, aren't we?
Indeed.
So let me be clear. VIDIMO is not a clinical application. It is an operational tool. But it will work in collaboration with clinical systems, and we can provide triage signatures, triage footprints of A&E, so that you can see in real time not only the volume of patients presenting, but the actual triage levels that they are currently registered at. And then within the hospital, we provide real-time a barometer. We call it an early warning system, where every ward gets real-time visibility of the volumes of people waiting in A&E, the volume of beds or trolleys in A&E, and similarly in emergency and acute wards as well. And using preset thresholds, they get to see the red, amber, green sort of local management status that is used in the national OPAL guidelines. And that then automatically plugs into the ability not only to notify staff within the hospital, but staff within the trust, or even further afield to STPs. The strategic transformation partners would be able to see multiple hospitals in real time and the current operational effectiveness of those hospitals. So if we go down into, let's say, the next level of granularity, we want to look at individual ward levels. Now, some people manage multiple wards and some people manage individual wards. And we, again, give that barometer for people to have a single dashboard where they can see the real-time aspect of every ward, and using a local management tool can set thresholds for other people to be able to be alerted.
It sounds like VIDIMO is trying to bring even health itself together.
Yeah.
Because over the years, I know, whilst working in health, I could see that there is a difference between A&E, acute, non-acute, and they all somehow work separately. So it sounds to me like VIDIMO is actually bringing the whole hospital together, because each one of those individuals, whether they're an A&E or working on an acute or non-acute, should be aware that there is a problem on A&E.
That's right.
Because patients are flowing in, and if they get that early sign and warning, they can start clearing the beds. So it is actually a very good application to bring them all together, to start working as one.
Absolutely, and it does it in a virtual sense. So again, it removes the need for email emails or telephone calls or constantly scribing on WhatsApp. It just gives real-time information at the time that you need it, and it allows a better transition of patient flow. Not because it does medical assessments, because that's not what we do, but it gives the whole life cycle visibility. So health will be able to see a patient transition from A&E through to, let's say, perhaps an acute ward, but also then see that patient transition into a social care environment, perhaps a D2A environment, or a care home, or extra shelters, as you alluded to earlier. All these things now become visible from a single platform.
Okay. Is the hospital able to set the internal escalations to their own liking? Because it would be good that each hospital actually sits down and looks at, okay, when do we want escalation actually to start? So that is also possible.
Yeah, it's totally at the discretion of hospitals and trusts. If they want to set thresholds low and perhaps run the risk of multiple notifications going out, it's at their discretion, they can do that. But over time, they will see trends and patterns develop, and they can tailor their thresholds and alert statuses to suit any particular time of the year, any particular events that may be occurring. They can adjust accordingly.
Okay, that sounds very good, because it's better to be safer and set it a bit lower, and then you find out what the threshold should actually be set. What always surprised me, and hopefully VIDIMO can assist with that, is that there is no real connection between community health and acute health. So is there a way that VIDIMO could actually assist community health and acute health at the same time? Let's say the patient is on A&E. Can we see that patient with a lower need, maybe who should have gone and seen the GP, can we see what the waiting time would be and where they could go, or where should we send them? And would community health be able to have access to VIDIMO as well? Because they will need at some point to send the patient to the hospital. Would they be able to see how many beds and where the beds are available for either fracture or cardiac or any other ward?
Well, we've tried to make VIDIMO, it's an interesting question, by the way,
it's quite big.
But we've tried to make VIDIMO as open and as transparent for as many people as we can. So we've covered ambulance trusts. So ambulance trusts, ambulance crews can use VIDIMO just to see what the current status of a hospital or the nearest hospitals to their immediate location is. So this gives them the ability to not just simply head to the nearest hospital, only to be then perhaps turned away, but it gives them a level of intelligence to say it's better to go an extra 4 miles to a further hospital because they're in a better status to accommodate the needs of this patient. Or if the patient need is specific to, let's say, a major trauma centre, ambulance trusts would be able to get that visibility as well. So there's no reason why that cannot be extended to community. There are many services that we could encompass and provide. It's just getting around the table and discussing what the need is and how we can address it.
I mean, you just mentioned the ambulance. I should have thought of that earlier, because at the moment, as we know, the ambulance has got a track record of being turned away during winter pressure times quite often. There's a lot of financial loss, but we are not even counting the amount of people who might have lost their lives because the ambulance was turned away. And the most important for us is to save that patient's life. Therefore,
of course. And I think the keys to most of these challenges, it's all about staff, beds and costs. And those three cannot be addressed in isolation. And to do so will inevitably result in failure. And we've taken a long, hard look at this, and we've encompassed all three at any one point in time. An ambulance trust last year spent £78.4 million on private ambulance companies to help them cope with winter pressures. And that results in something like over 500 crews were redirected from hospitals. So instead of, let's say, a patient taking an hour to get to a hospital and then waiting 15 minutes, they're getting to a hospital which is 1.5 hour, then they're being redirected to another hospital which could be another half hour, and then when they get to that hospital, then they have perhaps a 15, 30, 45 minute, 1 hour wait. And all that time is then taken away from ambulance crews that could actually be servicing other patient needs.
But also we have to think about the patient who is in the ambulance, who
Absolutely
might have
right.
benefited from an earlier treatment and his life would have been saved.
Yeah.
I mean, the one problem that VIDIMO might not have thought of is that there are certain times when the hospital, when the ambulance will take the patient to a hospital that belongs to that patient's borough. Yes, we can talk of repat, the patients can be repatriated, but how would VIDIMO address that? I mean, is there an ability on the system where you can repatriate very quickly within minutes over the system, or request for the notes or information from another trust?
Well, we don't per se deal with certainly patient notes, but we're happy to integrate with any system that does. I think it's important that we have a clear sort of division between clinical systems and operational systems, and we are at this point in time definitely addressing the operational.
Okay. The question was more whether the patient flow would actually show that that is a repatriation, and how whether VIDIMO would then show the transport or the transfer that is is required.
Right, yeah, that's a given. To reiterate, we are trying to keep our system as open as possible. And so it's not limited to trust, it's not limited to hospital or care home or local authority. So when a patient comes in from an ambulance into an A&E and endures the life cycle of perhaps going to another hospital for specific treatment, perhaps going to a care home or onto D2A and then a care home, that entire journey is captured on VIDIMO. So, and it's an audit trail effectively. It will tell you who requested the booking, when it was done, when it was accepted, whether the transfer required transport, whether it required porters. All of these services are accommodated in VIDIMO in real time, and that audit trail is there for anybody to look at at any time.
Okay, sounds good to me. But as we all know, majority of the consultants have the last word. So what would the consultant of a major hospital trust find beneficial, and why?
Okay, well, that's again a really interesting question, because most of the focus is upon the clinical aspect. With the tool that we use for A&E to capture the triage footprint, we also give the ability for people who are conducting the triage to note specific specialties that may be or required. And from that, we can build up a dashboard, let's say for cardiology. If there are 7 patients in A&E requiring cardiology type treatment, a specialist can have their own view of the world. So they will see those patients coming into A&E once they've been triaged, they will appear on their view of the world. Now, whether they wait for A&E to contact them or take the more proactive stance of going to A&E to get on top of a situation, that's at the discretion of the consultant.
That sounds very good, because very often a piece of paper where the note on a patient is probably written or a telephone call not made can cause delay in patient's treatment. To sort of conclude, everybody always talks about stats.
Yes.
Everybody wants stats. We're talking about loss, we're talking about length of stay, we're talking about detox stats. ADAS wants stats, Department of Health, everybody. So has VIDIMO addressed the stats? And if VIDIMO has, then if you could break it down for me and tell me exactly what we could see.
Yeah, sure. Well, when it comes to stats and reporting, everybody's got let's say, a specific and tailored need for their own environment. And the approach we've taken so far is to be reasonably vanilla, but take all the sort of the key measurables and offer it in a very easily read format. So it goes from the lowest sort of levels of, let's say, individual ward management. So if people want to see the metrics on wards, that can be done. At the hospital level, same thing, but different view, higher level, but with the ability to drill down into the detail if any dispute or any disparity is found. Similarly, then we can ramp up to local authority in the case of social care, STP level. If there were, let's say, a regional command centre, we could offer statistics at a regional level. We could offer it at DOH national level if that was required. The bottom line for us is we capture every bit of information that is pertinent to good operational running of health and social care. And how people want to view that information is up to them. And we're quite happy to work with any trust and any local authority to make that view as seamless and as painless as possible.
Well, thank you so much. As we all in health and social care continue to put patient first, in conclusion, if you could tell me how VIDIMO actually benefits the patient.
Directly, one could argue there's no direct benefit for the patient because they don't actually get access to VIDIMO. But the benefits patients enjoy through more expedient processes, greater visibility, there's less delays for patients. So it's again, to reiterate, it's a great collaborative tool that offers the most efficient way of getting patients flowing effectively, not just through a hospital, but through the entire life cycle of the system. So there is clear benefit for patients,
indeed,
without doubt.
And most of all, quicker treatment and quicker bed,
absolutely,
extra shelter.
Absolutely right.
Benefit.
Yeah.
Thank you very much.
You're welcome. Thank you.